going to get one of those, okay? You're going to take the Tegaderm off, leave the tape on so that the IV doesn't come out, because you're saving the IV. You're just changing and adding more antibacterial to this, okay, or the antimicrobial. So you have your gloves on. You're going to take off the Tegaderm. You're going to take the sponge, squeeze it, or use the pad. You're going to clean for a minute in circular motion with this like you guys did before, okay? 2 inches, clean, clean, clean. Let it dry. If you want, you know, if the tape is worn out or it's getting gooey, you can take this and maybe tape it to this side now or move it a little bit, but you don't have to, okay? Once this dries, you're taking a new Tegaderm, new date, time, and you're all set. That's it, okay? Let's see, converting IV to INT. So this is, okay, so if you get a patient from the ER, you get a patient from a squad, they may come. Here's one.
Oh wait, what does it
That's
mean
all
to
right.
get a patient from a squad? I'm sorry.
Like you call 911.
Rescue squad. Okay.
Rescue squad.
Ambulance. We could have gotten that for you.
Oh, I almost got it. Okay. All right.
Did you get that on video?
Yeah, I did. Okay, so hold on. This is how they'll come a lot of times. Ignore this. Okay? The EMT or whoever's putting the IV in sticks the IV in. They quick attach it to the IV fluid and get it running. They don't take the time to, you know, flush, do all this, attach this. Okay? So now you get the patient that you need to take care of. Okay? If you need to give something else than what's running, you don't have access to do that. Okay? This is where you're going to want to change this, which is an IV, to an INT. That way you can plug the IV in here, but then you have another port to plug something else into if you need to, or push something if you need to. Okay? So again, gloves, you're just going to unscrew it like I screwed it in there. Okay? You have to prepare this like you do when you insert. So you got to flush, keep this sterile, okay? Knock the lid off, and then attach your INT to it, ready to go, okay? And at this point you can tape it how you want, just like you did before. So it's just simply keeping that tip sterile, keeping this tip sterile, in and out.
Now do you have to hook this one back up?
Yeah, so you'd alcohol this, plug this back in. Does that make sense?
Mm-hmm.
Okay, so yes.
Oh.
Oh, you were itching?
Sorry.
I saw the hand go up. Okay, so that's that. And then discontinuing, very basic again, gloves. You're gonna just untape if you can the areas. So we're gonna untape here, untape here. You're gonna have a 2x2 or 4x4, something to apply pressure. You're going to take the dressing off. Okay, hold on here. Okay, then you're going to take, do you have one? Just grab me one. Well,
A 2x2.
thank you. Okay, so you have your 2x2. You're just going to apply pressure at the site. Just a little bit, not a lot, because you still have to pull this out. Okay, you're going to pull it out and hold here. Patient wants to hold it, fine.
Anybody got to do that in clinical?
I did. You were there.
Okay, so what's important when this comes out is that it comes out intact. The entire catheter is still there. It's not broke off. It's not jagged. So just a quick look at this when it comes out before you put it in the sharps. That's what's important when it comes out, okay? And to hold enough pressure, because if you let go of this, it'll keep bleeding or they'll form a little well there, okay? So hold it here, check this, then you can throw it away. That's that.
Now at our checkup, we throw the full thing away?
Yeah, this whole thing we go in the sharps.
Okay.
Okay, so that's that. Okay, so those are the 3 little short things on here. So change the dressing. We're going to have it as an IV. You're going to have to get an INT ready and convert it. Okay, then you're going to have to discontinue the HEPLOC or the INT. Okay. All right, now you guys might want to go get your papers so you can take notes.
You got enough time and
Is this
battery
the
on
pause
that thing?
button?
That is.